Okay. So it sounds like there's a lot of different types of providers here in the room today. It's really great to be here to get to talk to all of you about what it is that that professionals like myself do. So as a provider, I imagine that from time to time you feel frustrated, wishing you could sort of have a second set of eyes and ears, that you could be in two places at once, that maybe this person that's presenting in front of you is maybe not painting for you a totally accurate picture. You have a frail, elderly patient or client in front of you who's lost 10 pounds since the last time you saw her. But no, I have a really good appetite and I definitely get my 3 square meals a day. You have a patient or a client with early dementia who tells you, I have no difficulty managing my medications, and yet their blood pressure is consistently out of control and they never seem to need refills on that blood pressure medication. Sometimes you just need a reliable source of information. You need somebody who knows a little bit more about what's really going on the inside, the internal part of your client or your patient's lives. And this is just what we do as geriatric care managers. So I'm really excited that Julie and the Glenner Memory Care Centers invited me to be here today to talk to you a little bit about care management and sort of why our profession exists. So this is just a quick overview of what I'm going to talk to you about. I'm going to explain to you as best I can what a geriatric care manager is. I'll talk with you about how care managers work with our clients and with their families and their professional representatives. I'll be discussing the team approach that we take to taking care of vulnerable older adults. And to clarify, we work with older disabled adults of any type. There's no specific age that someone has to be to work with a geriatric care manager. We work with people with all types of physical or cognitive disabilities, as well as people living with serious mental illness or older adults with developmental disabilities as well. I'm going to give you a quick little case study, and hopefully we'll have a little time that I can answer some questions. So I'm being ambitious with my 25 minutes. Yeah, we'll see how my voice holds up here. So I'll start with what is a geriatric care manager. We are social workers, nurses, gerontologists, counselors, therapists of a variety of different types. We come from a wide range of professional backgrounds. There are geriatric care managers all over the country, and in fact in a couple of other countries as well. There's about 2,000 members of our National Professional Association, and I'll give you the contact information for that association a little bit later. We are private professionals that a family will hire to be a guide and advocate for an older person. I described for you a bit ago the types of people that we work with. We're a guide, we're a resource for people that are sort of traveling through the maze of the long-term care system here. In San Diego, I'd say there's about 15 or so professional geriatric care management providers with a variety of professionals that work within each company. So there are a lot of good geriatric care managers out there in San Diego County, and yet a lot of people have no idea that we exist, or if they do know that we exist, they just don't know what we do. So we serve as an advocate for our client, and when I say our client, I'm talking about the person who is the recipient of care. And I make that point of differentiation because it can get a little bit confusing. In my line of work, as you might imagine, it's almost never that my client is the one that calls me up and says, I really need a geriatric care manager, I'd like to hire you, can you come out to my house and help me? In fact, that has never happened, not even once. So we're usually being engaged by someone else. Often it's our clients' funds, it's their money that is paying for the geriatric care manager, but somebody else is sort of managing that for them. Often they actually have another legal representative. They've got a private fiduciary in place. They have a family that's been named as durable power of attorney for healthcare and or their finances. Somebody else is their legal representative. So regardless of who's paying my bill as a geriatric care manager, regardless of who picked up the phone and made that phone call and engaged us, the person who's receiving the care is always my client. I belong to the National Association of Professional Geriatric Care Managers. We have a set of standards of practice and a code of ethics that dictates this. So if I'm ever in any sort of a dilemma as a care manager as to trying to make a decision between what my client would want in this situation and what my client's representative might want in this situation, I've got a good code of ethics that keeps me grounded and focused on the needs of the older person. So the term care manager can mean a lot of things. It's not a protected professional term. You can't just hang out a shingle and call yourself an attorney or a doctor, but you can hang out a shingle, any one of you, and call yourself a care manager. So I just want to explain the difference between what other types of care, what you might sort of know as a care manager out there, and how we define care management sort of internally as a profession. So there is certification as a professional geriatric care manager. Membership in our national association is a requirement, and there are 4 different types of certification, and I won't bore you with all of that. There's information about that available through our professional association. I just want to sort of make the point generally that there is, in fact, certification, which requires training. It requires at least 2 years of supervised clinical work, the passing of a certification exam, and then ongoing professional education. So there is a difference between somebody calling themselves a care manager and somebody who is, in fact, a certified professional geriatric care manager. So I'll just leave it at that for now. In terms of how to identify a certified professional geriatric care manager, first of all, you can just ask. You can look for the credential at the end of the individual's name. You can ask what their experience is, but you can also do a search through our national database of geriatric care managers. And again, I'll give you that contact information a little bit later. Here we go. So, how do care managers work with older clients and their families? We always start with an assessment. It's a comprehensive biopsychosocial assessment. It takes place in our client's home. Home can be any number of places. It's usually their family home. We're generally being brought in because our client is still living at home and their goal is to stay home. But often we are working with families or working with an older person who lives in a board and care home, an assisted living facility, skilled nursing, who may be in a hospital setting. We may be doing the assessment in the hospital and then sort of continuing the assessment process in their residence, sort of preparing them for a discharge home. So we do the assessment of the person in their environment. And in terms of preventing elder abuse, we are very attuned to the risk factors of abuse. If we have any suspicion that the older person may be a victim of abuse of any kind, in particular, the types of abuse that we tend to see most as geriatric care managers is that of isolation and undue influence, which I'm sure you heard a bit about earlier today. Excuse me. So if we have any suspicion that that is going on, we will make a point to interview the client alone and talk to as many other people as we can in that person's life at some point during the assessment process. We often have to do this very delicate, very diplomatic dance during the course of the assessment, and sometimes the assessment is going to have to take place in a few different steps in order for us to get to talk to all of the people that we need to talk to get this whole picture, but we will do that. As care managers, we're really attuned to, I liked what Annabelle was saying before about people's, people can make bad decisions. This is sort of a right that we have. And as care managers, we're really attuned to the fact that we have to defend an older person's right, an older person who still has decisional capacity. We have to defend their right to make really bad decisions for themselves, to take bad care of themselves. People have the right to do this, but we have to know the difference when we're looking at somebody who does not have decisional capacity and is not taking good care of themselves. We then have an obligation to try to do something about that. Geriatric care managers are big reporters to Adult Protective Services, as you might imagine. We've all got them on speed dial, and we're calling all the time. We're making reports all the time. So during the course of the assessment, we're looking at a person's medical background, we're assessing their cognitive status, we're not making diagnoses of any kind, but if we suspect that somebody, we're doing a little bit of sort of screening, and we suspect that somebody needs some medical or neurological intervention of some kind, they need to get connected to an attorney, for example. We're not giving legal advice, but we're going to give them some information to help hopefully connect them to those other resources that they need. So we're looking at, again, medical history, cognitive status. We're really investigating their social support system, and this is where we learn a lot about potential abuse situations. We are trying to understand their financial resources so that we're not making recommendations that are totally inappropriate based on what their level of income might be. And we get brought in for a variety of reasons. Sometimes we're being asked to just sort of come in on a short-term basis. Can you do a home safety evaluation, take a look around, give us some advice about things we could do to improve this care situation, and then we'll sort of take it from there. We do those types of care planning consultations pretty frequently. Sometimes we're being asked to make recommendations about placement. And as a geriatric care manager, our clients are paying us privately. We receive no referral fees from any type of service or community or provider that we might refer out to. So our clients are counting on us for a really objective set of recommendations. So if somebody comes to us for placement consultation, they know if we refer them to these 2 or 3 different assisted living facilities, it's because we've done a thorough assessment. We think that these are appropriate for them, and we'll tell them why. There's nothing in it for us. We help a family put together a really comprehensive care plan. This can mean a number of different things. It may involve, and it often does, bringing in-home support. It may mean sort of rallying the troops, getting the family on board and getting the family all sort of oriented in one direction, working with the same set of goals, working with a plan, giving everybody a job based on their strengths and their availability and what resources are available to them. Or again, it may involve making recommendations about placement. And a big part of what we're doing is just connecting families with this whole huge network of resources that we have in San Diego. I mean, just at this one table alone outside that I saw on my way in, you see this just pile of incredible information. This one little event here in San Diego going on today. There's so much out there. San Diego is a wealth of really wonderful resources, but it is a maze, and it's really hard for people to know who are the good providers and who are not. So this is a big part of what we're doing, is just helping people sort of understand the range of what's out there. So what are we doing in the care team? Our role in the care team, and when I refer to the care team, I'm sort of talking about the whole constellation of people that are involved in an older person's life. It's different for every person. But what we're doing is coordinating that person's care among a whole lot of different providers. Has anybody heard the term silos of care? This is a sort of a common expression we use to describe our healthcare system in the United States. We have a wonderful system, but it's a very disintegrated system. You have your primary care provider here working in one silo. You have your cardiologist here. You have hospital emergency departments. You have neurology. They're all wonderful. They're all taking wonderful care of the patient, but very rarely are they actually talking to each other. They're operating in these silos. And so a big part of a care manager's job is to just make sure, especially when it comes to healthcare, but this actually refers to all different facets of an older person's life, that all these different people that are working with all different types of information about that patient or client are all working with the same set of information, working toward the same goal. Goal setting is a big part of a geriatric care manager's job. This is really what we're doing. This is at the heart of what we're doing when we do an assessment. We're sitting down with that older person and trying to understand, sort of who they are, but also what their goals are. They want to stay home. Okay, well, what does that mean? What exactly does that mean to them, staying home? What's their perception of what's going to happen if they stay home? So we're trying to really get at what is it that what is it that we've been hired to do? We set a goal, we put it down on paper, and we talk about the steps that we're going to take to get there. We are providing support and supervision of in-home care services. You've heard some stories today already, just in the short time that I've been here. I've heard a few stories about people that have professional in-home care and still turn out to be the victims of abuse of some kind. This happens. Geriatric care managers can provide additional support to the caregivers, whether they're paid or not, in terms of additional training, support. Sometimes, goodness sakes, caregivers' jobs are incredibly hard. And even the most skilled, the most experienced caregiver, this just happened to me yesterday, can absolutely have a meltdown on a tough day when a person with advanced dementia is punching at you and telling you that they hate you. This is a hard thing for a caregiver to handle. Care managers can be instrumental, whether it's our employee or not, in providing that additional support, problem solving, and sort of crisis management that a caregiver needs. We act as a liaison for clients who live in a residential care setting. As I mentioned, most of my clients tend to live at home, but we certainly work with plenty of folks who live in boarded care homes, assisted living, or skilled nursing facilities, and maybe just need a liaison, someone to work with the facility staff to make sure that they really understand who this person is, what their needs are, and make sure their needs are getting met. Many people have family that are very involved, and we're not involved there because the family has sort of thrown their hands up and doesn't want to be involved. But often the facility will bring us in because the family is frankly kind of hard to deal with. They're very emotional, and a geriatric care manager is a little bit more objective and can provide that sort of professional buffer and perspective around that resident's care. So we're the eyes and ears for many different types of professionals. We're going into doctor's appointments with our clients, usually, in most cases. We're getting that information, again, connecting all the dots, making sure all the providers have the same information. If the doctor is making a recommendation, we make sure it gets in the care plan. If they've ordered a new medication, we make sure that the pharmacist is aware of it. First of all, that all the drugs are being ordered from the same pharmacy. If there's changes to the diet that need to be made, whatever those sort of details are that tend to get sort of lost in the shuffle after the doctor's appointment, the geriatric care manager is making sure that that happens. And again, we're referring to adult protective services when needed, and this is frequent, unfortunately. But I think what's important to know is that often a referral to adult protective services can also be used in a really therapeutic way. I had a family several years ago, a husband who was taking care of his wife with moderate dementia at the point that I got involved. And I would describe the way he took care of her as he was such a dear. It was sort of benign neglect. He just really he didn't have good caregiving instincts. He really loved his wife. He didn't understand Alzheimer's disease. And so without going into a lot of the details of the situation, I can just say he had sort of let a very unsafe situation evolve over the years. And so when we got involved, I saw all these red flags when I did the assessment and told him, here's all these things that need to get taken care of. And he said, that all sounds really nice, and maybe I'll get to that someday. And as I worked with him, as the weeks went by, nothing was happening. He let us bring in a caregiver. He let me make some very minimal changes, but things like her, the fact that she was like, a fall down this set of stairs was imminent. She wasn't eating properly. He was not taking care of her incontinence issues properly. The big things were not getting changed. And so I just I called his daughter. I let his daughter know, I'm going to report your dad to Adult Protective Services. This isn't meant to be mean. This is going to help. And in fact, it did. Adult Protective Services, goodness, sort of breaks my heart, but they showed up at their house on Christmas Eve in the middle of family dinner. It was sort of awful timing. But the daughter was eternally grateful because the dad, he jumped right to it. You can bet that on December 26th, he got my care plan back out and started ticking off the tasks and started making things happen and took beautiful care of his wife for the rest of her life. So Adult Protective Services referrals are not always ugly, and they can be very therapeutic. A well-rounded care team. I think our goal as a geriatric care manager is to partner with our client and coordinate on their behalf a really well-functioning care team. I'm speaking sort of blue sky. This is how we hope it works. It doesn't always work out that way, but that's always our goal. Care managers don't know it all by any stretch of the imagination. My background is in social work and in public health. I am not a nurse, I'm not a physician, I am definitely not an attorney or a fiduciary. There's a lot that I don't know, and I absolutely have to rely on having a good team to help me in taking care of my clients. As a care manager, I can provide a really objective perspective. When I first get involved, I'm coming in with totally fresh eyes, ears, nose, taking all those senses when I come in and see what's going on in my client's home. We can be an outlet. I think this is a really important point when it comes to the prevention of elder abuse. We can be a really important outlet for stress relief for a very burned out caregiver, a family member, not just a professional caregiver, but a family member. As I'm sure you heard at some point today, most abuse does occur at the hands of family members. Geriatric care managers are, with our sort of professional skills and our perspective on a person's individual situation, can be a great outlet, a source of respite, it, but also just someone at the other end of the line that knows their loved one, knows how infuriating it can be to take care of them, how difficult it is, how hard it can be, and sort of talk that person off the proverbial ledge when the stress is really getting to them. We're a reliable first point of contact for people who are, again, sort of navigating this crazy maze. Things may be stable for a lot of our clients. Hopefully, our getting involved helps really stabilize a difficult situation. And hopefully, we stay involved for a long time and the situation remains totally stable, but people know they've got a relationship, again, with someone who sort of knows what baseline is for that family. They know we're a first point of contact when things change, when that sudden change of status happens, when that fall or that cardiac event, whatever it might be, when that change happens, they know who they're going to call first, and they sort of know how to get the ball rolling through their point of contact with the geriatric care manager. And again, we're a critical source of information, I think, that can really help every member of the team to identify potential abuse and coordinate a response. So I won't go through all the different features you see here, but this is sort of how I visualize a care team, the care recipient being my client, the geriatric care manager being right there in the middle. You can just sort of see visually, this is a lot of different people to keep talking to each other, to keep information sort of flowing between all those different parties. Some of them overlap with each other. Some of them, they'll never talk to each other were it not for the presence of a good advocate for that client. If the client can self-advocate, fantastic, but you can see as somebody ages, becomes more disabled, becomes more cognitively impaired, how difficult it becomes to make sure that information is actually getting everywhere that it needs to be. The advocate for the client does not always need to be a paid, private, professional geriatric care manager. It can be a family member, absolutely, but that is a big job. It's a difficult job for a lot of people. So I just want everyone to know we're a resource out there for those family that need it. So I'll give you a quick case study. I'm going to tell you about a long-time client of mine named Fred. I think as a care manager, I have a lot, like probably everyone you've heard from today, I have a lot of horror stories when it comes to situations of elder abuse. I think what's important to remember is that elder abuse happens everywhere, and I'm going to tell you the story of this gentleman who, he had a great deal of support. This was not an isolated person. This was not somebody who was gravely disabled. He was 90 years old, caring for his wife who had Alzheimer's disease. His wife lived in a facility. He didn't have a lot of money, but he did have a very loving and involved family, but none of them were local. So Fred was 90 years old when I first got involved with him. Generally in pretty good health, so probably an unsafe driver and really hard of hearing, but otherwise doing really well. His daughter hired us. Basically, she wanted her dad to have a little bit of in-home support. We've got some caregiving, very minimal caregiving services in there, a few hours a day, a couple of days a week. So a pretty independent guy with lots of support and decent amount of resources. Again, he had the family, the daughter, and two very involved grandchildren. So we were providing caregiving services a couple of days a week. I got a call one afternoon from the caregiver that was working with Fred, who had overheard a conversation. She just overheard his part of the phone call. This was, I don't know, 5 years ago or so. It was before we really knew about the Western Union scam. Has anyone talked about that one already today? I won't go through the details of it, but now it's a really well-known telephone scam where somebody calls and pretends to be a family member of the older person, saying that they're in some sort of a pickle and they need them to wire them some money right away, or they're never going to get out of, Turkish prison, or, whatever it might be. And my caregiver overheard these little bits and pieces of this conversation, and the hairs went up on the back of her neck, and he got off the phone and said, okay, we need to go to Walmart because I need to wire $1,500 to my grandson. And she said, wait, what? It was $4,500. the caregiver, she saw all the red flags. She said, no. He was describing the situation where his grandson was calling her from a Canadian jail and had gotten into some sort of a mess and he needed to wire money. And she said, something about this just doesn't sit right. Why don't we call your daughter? She'll know if he's even in Canada and if everything's okay. And he said, no, we don't have time. We just need to go. So she said, okay, quick, I'm just going to use the restroom before we go. Went in the bathroom and called me and said, we're on our way to Walmart. I don't know what is going on here, but I can't imagine that his grandson is in a Canadian jail. Could you do something about this? So, of course, I knew that his grandson was a police officer in Louisiana and was fairly certain that this was a scam, although I hadn't heard about this particular scam yet. I was pretty sure about what I was hearing. Called his daughter. She said, no, of course my son is not in a Canadian jail. Do something. So I dropped what I was doing and met the client and the caregiver at the Walmart. Unfortunately, he had already wired the $4,500, but he was still there. The caregiver was awesome, and she kept him shopping in the Walmart until I could get there. We went back to the person at the Western Union desk that had helped him. I got the thing reversed. We ended up, reporting it to law enforcement, took care of the whole thing. But it was so shocking to me how somebody with so much support, with a good caregiver, with a loving family, with a care manager involved, could still be the victim of abuse. It's incredible to me. And I think it's a really good example of how vulnerable absolutely every older adult is. I think Nancy Ewan touched on this, that this is a really commonly overlooked part of a person's vulnerability and the need to protect them. So that's it. I've talked to you about the role of a care manager, putting together an effective team. I mentioned before about how to identify a geriatric care manager down at the bottom here, and apparently you all will get emailed the slides, so you'll have this. But that's the contact information for the National Association of Professional Geriatric Care Managers, so you can find a certified professional basically anywhere in the country. There are a few states where it's hard to find care managers. I looked for one in Dubuque, Iowa, not too long ago, and I could not find one. But mostly you can find a good care manager just about anywhere. And you have my contact information if I can be of any support to anyone anytime. Don't hesitate. Any questions? 4 o'clock on a Friday, everyone's tired. All right, well, thank you all. There was a question.
Go into geriatric care management. What kind of undergraduate degrees do they have, or does it matter?
It does matter. In order to get certified as a geriatric care manager, you do either have to have a degree in one of the health and human services fields or sort of a commensurate number of years of experience working in the field. I'd say most of us tend to come from a background in psychology, social work, or nursing, but there are care managers that come from a variety of backgrounds. Okay, thanks. Yeah, absolutely.